Welcome to our community. Susie Thomas with you this morning. So happy to welcome Stacy King. She is going to explain Medicare to us. Good morning, Stacy.
Good morning.
Okay, I'm a bundle of questions here.
Okay.
So first of all, let's go with the beginning. Suddenly, you're 64 years old and you're not thinking about this at all, but suddenly people are telling you, oh, it's time to get signed up now. So tell me all about this.
Right. Well, by that time, you probably have about a 6-inch stack of mail that you're getting from everybody, and you just don't know what to do. So I try to be a good Medicare resource for the community. And what's going to happen is before you turn 65, you have a 7-month window to sign up for Medicare. So you have 3 months prior to your birthday month, and 3 months after your birthday.
What if you don't? What if you don't do it?
Well, if you're on group insurance, for instance, you can stay on group insurance.
So you could turn 65 and not be signed up for Medicare.
Right.
Because you're still on group insurance with your employer or what have you.
Correct. You could be automatically enrolled in Part A if you're an American citizen and you've worked 40 quarters, which is 10 years, which most of us have worked 10 years. So you may get a Medicare card, the red, white, and blue card, that just has Part A. So you're entitled to Part A, and then Part B is what you enroll in. And A, I like to say, covers the 3 H's: your hospital, your home health, and your hospice. That's
Okay.
what's covered in Part A, and the first 20 days in a skilled nursing facility. But B is something that you can choose to enroll in.
And what does B include?
B is your doctor visits and your outpatient. That's what B is.
Stuff you use more than A.
Right, right.
And then what's D?
D stands for drugs.
Okay.
So D is drugs. So you're going to get a little alphabet lesson.
Is there a C?
There is a C.
Okay, what is that?
Because C combines A, B, and D for C.
Okay.
So that's the difference between a Medicare supplement plan. With that, you need a drug plan, or a Medicare Advantage plan. An Advantage plan is A, B, and D combined to make C.
So a C is Medicare Advantage.
It is, yes.
And now I know once you are on Social Security, they just take that out of your Social Security automatically, so you don't have to think about it, correct?
You can choose to have it come out of your Social Security. You can choose to get a bank draft, or you can choose to get a coupon book. Some people still want the old-fashioned coupon book.
Ugh, no.
Yeah,
Okay.
I know.
So,
Yeah.
all right, for many people, we didn't think about having to buy insurance at all because it came with your employer. You had what you had. You got a card. You had a group number. Your doctor knew it. They knew that for like years and years, decades. It was always the same. And then this hits a lot of us out of the blue. Like, first of all, how could I be so old that I need this? And second, what am I doing? I've never done this before and I have no idea what I'm doing.
Yeah.
So you are here to explain this to us.
It is so confusing.
It
And
is.
I get confused too. So sometimes I have to seek out the answer. If I don't know it, I will certainly find it and get back to you on that.
I think my first question is, why does the government suddenly want to be paying for my health care? Why?
Oh, that's a hard question to answer. But in 1965, which was a great year, the year I was born.
Oh, awesome. For that reason, it was good.
Yeah.
Yes.
Lyndon B. Johnson signed into practice Medicare so that the government could help us, fund
But
our health insurance.
The government tends to not be a benevolent organization. And I think some of us start to think, whatever government is big enough to give you everything you want is also powerful enough to take away everything you have. So would there be, once you have to go on Medicare and then you're on Medicare, please alleviate my fears that at some point they say down the road, sorry, we're not paying for that, and they're just trying to weed out the herd.
Well, there is just original Medicare that you can go on, so you don't have to pick all of these plans that are out there. You can just have Original Medicare. With just Original Medicare, it is law. The CMS, the Center for Medicare and Medicaid Services, has a law that if you're on Original Medicare, you have to have a drug plan. Okay? So if you're out there and you just have Original Medicare, you absolutely have to have a drug plan. And I have found some people are out there that they don't have a drug plan. Nobody ever told them they have to have a drug plan.
Right.
So you will be penalized 1% of the average premium for every month that you don't have a drug plan.
For how long?
For the rest of your life.
For the rest of your life,
after month after month.
Okay, not
Yes.
just once you get a drug plan, you're still paying the penalty.
You're still paying the penalty.
So
Yes.
we don't want to pay that penalty.
It averages about 33 cents a month. That's what it is now, which doesn't seem like a lot.
No, but
if
over
you haven't
20
had-
years.
Which I have had to be the bearer of bad news.
Yes.
That I've had a lot of people this year that have not had a drug plan for over 10 years. So that penalty will come out of your Social Security check.
Oh my goodness.
So it's always good to know about Medicare, to be educated, and then know what you're. Also, I'm going to throw this kicker in there too.
Okay, yes.
If you are entitled to A and you never enroll in B, and you're not on your group insurance, you're still going to be charged a penalty for not signing up for Part B. B as in boy. And that's 10% of the average.
Whoa.
So that gets a little bit more costly. And here's another little tidbit of truth. I like to call this Medicare Minutes with Stacy. So the other tidbit of truth is if you're on group insurance and you have credible coverage through your group insurance, you do not have to enroll in Part B.
Okay.
B as in boy.
And you don't get penalized.
You don't get penalized. But I've had people that'll say, well, my friend or my buddy or my coworker or my neighbor told me that I need to do this or that, and I need to do this or that. Don't always go by the advice of a friend. I had a gentleman that was paying for Part B for over 5 years before he came off of his group insurance. He never had to pay that. He's not going to get refunded
Right.
that money.
Right. So he was unnecessarily paying for it.
Unnecessarily paying it. Which
Wait
is
until you
usually-
have to.
Yes.
And then be on time. Don't miss.
Correct.
Yes. Okay.
Yes.
What's the difference between what is regular Medicare? Is that Part A?
Regular Medicare is Part A.
Okay. And
Okay,
that's the
and
3
then-
H's.
The 3 H's,
Okay.
yes.
And then the Medicare Advantage would be ABD, which is C.
Original Medicare is A and B. Okay, just A and B.
Okay.
Okay, that's what's going to be on your red, white, and blue card.
Okay.
And it's going to have an effective date on there. So how do you sign up for Part B? Right?
How do you? Please help me.
You can go to the website www.ssa.gov.
What's SSA?
SSA, Social Security Administration.
Got it.
.gov, or you can make an appointment and go down to the Social Security office. If you make an appointment, you don't have to wait in line, but you can go down to the Social Security office and enroll in Part B.
Part of the confusion is that this all happens almost 2 years before you go on Social Security. Couldn't they just make it all happen at the same time?
Wouldn't that be nice?
Yeah, it would be great.
Yeah.
Can we suggest that to someone?
Yeah.
Okay. Help me understand also the difference between Medicare and Medicaid.
Medicaid is based on your finances. So there are several different levels of Medicaid. So you could have like that could be a whole different show, but you could have like it is based on your finances. So it's based on your income, and you can apply for low income subsidy. And there's different levels, like there's a dual special needs plan, which is also called a DSNP. And then there's people that have partial low-income subsidy, and there are people that just have help with their prescription drug plan. So there are different levels. Quimby, Slimby, there's different levels, and it just depends on your finances, your household income, whether you're a single, whether you're married, and your household income. So there are charts, and every year that income and that level and those charts and those stipulations change. So that is based on your income.
Okay.
So you can have Medicare and Medicaid.
At the same time?
Yes.
Based on income?
Yes.
Okay. Best thing would be to talk to an expert, yes?
Yes.
Okay.
Yes.
Yeah, because can anybody sit down and figure this out themselves? I'm going to guess no.
It is good to have a Medicare advisor.
Yes.
It really is. You have advisors for everything else. You have accountants for your taxes. You have insurance agents for your home and your vehicles. So it is nice to have a Medicare advisor.
Very wise. Okay. Let's throw one more little monkey wrench into this. A lot of people have gone the route of health sharing rather than health insurance. So let's say you've got somebody very healthy, haven't used anything, but they've got it, they're covered, but they're maybe self-employed or for whatever reason they went the health sharing route. So now they're trying to work in, do I have to get Medicare? That answer you say is yes. Yes, you have to, unless you're on a group plan.
Right, unless you're on a group insurance plan.
Okay. So can those work together? Can health sharing and Medicare work together?
Well, they do work together, especially for, let's say you have a couple and the husband is 65 and the wife is 63. So she would have to have a plan for a couple of years because he went on Medicare.
Okay.
So, and usually when you do compare dollar for dollar, it does behoove you based on your benefits, and every group insurance is different, to sit down and say, you know, if I'm having $400 taken out for my wife and myself to be on my group insurance plan, but I could get off of this group insurance plan and we could both go on Medicare. Well, based on your county, based on your zip code of your county, there are premiums out there that are zero. Zero premium. So would you want to pay $400 for your employer and not have, for instance, vision, dental, hearing, over-the-counter benefits, and all the other extras that all the carriers, they all try to outdo each other every year? Or would you stay on your group plan? So we do what's called a free health benefits analysis, no cost, and you just sit down and we just compare your group benefits and what you're paying versus Medicare and what benefits that you're going to get. Because every carrier they're all similar, but
you can
each
take a
have
look
different
at all of
benefits.
them and
Right.
see what is going to work best for you. Because I think a lot of people drag their feet because you're in a health sharing thing and it's costing way less than any insurance, and it's costing way less even than Medicare is costing every month. And why wouldn't you want to stay on that and save the government some money and, you know, all of that? But we can't because that's the law. So there we go. Okay, you're explaining it to me. All right, we are going to take a short break. We're visiting with Stacey King. First of all, Stacey, how can people get a hold of you to find out more about this?
My cell number, I'll give you my cell.
Really?
Yeah, sure.
Thank you. Okay.
330-265-3670.
Okay, and people can just say they heard about you here and they've got Medicare questions and you know all the answers. We're going to be back with Stacey after these words. You're listening to Our Community. Welcome back to Our Community. Susie Thomas visiting with Stacey King. She's explaining Medicare to me, so I think there's a special crown in heaven for you, Stacey, trying to explain Medicare to me. You have a very interesting story yourself. Tell us a little bit about it.
Okay. Well, I was a physical therapist assistant for 30 years. And one day I just, love those Pinterest crafts. And I was saying, I just want to make this. It's a snowman on one side and it's a pumpkin on the other side.
Cute.
So I went and grabbed some logs, from the backyard. We have some woods. And I went into the barn and I started to saw on a miter saw. And without making this too R-rated, I don't know what the listening audience is, I proceeded to almost saw off my entire left thumb.
Oh my goodness.
So it was just dangling there. So
you had to have been in pain and in shock all at the same time.
yeah, a little bit, because not so much pain. It felt like a stabbing knife, like I was stabbed with a knife initially, like a burn. But since I sawed through everything, the nerves, everything, tendons, ligaments, nerves, bone, everything. So my friend called 911. And
were you alone, or did you?
I was alone, yes.
How did you hook up with the friend?
I kept dialing 911 on my iPhone.
Yeah.
And it wanted me to put in my password.
Are you serious?
Yes, I'm serious. But there is an emergency button on your iPhone that I know now. So everybody needs to know there's an emergency button on the outside of your iPhone, so you don't have to dial 911.
Okay.
And so I called my friend Jill and I said, I'm in the barn. You have to know that I'm all by myself in the barn. I've sawed off my thumb. You need to come and take me to Crystal Clinic. And it was a Saturday night. And so she said, I'm on my way. So in the meantime, I called other people to come, and the ambulance was there within 5 minutes. So I went to the hospital.
What did they do? Because let's tell the happy ending. You have a thumb. You're totally whole. What did they do to save that?
Well, Dr. A.J. Seth.
Love him.
Yes.
Yes.
We go to church together. He, 2 surgeries later, and several $1,000 later.
Yes.
So my thumb got fixed and put back together, and
Yes.
I went through about 4 sessions of occupational therapy, and it took a really long time for that. So I have I don't have the full. I'm missing my last joint there,
Okay, can't
but I
tell.
just don't have the strength. So I lost my job.
Now that
So-
seems illegal.
I had short-term disability, had 1 month of long-term disability, and I said, while we were switching contracts, so in the therapy world, your contracts can switch. You just feel like sometimes cattle on an auction block, honestly. So I had lost, in 6 years, I had lost 6 contracts. You go have a contract, then you have another contract, and you go to this facility and they lose the contract, and then they go in-house, and then they go with an outside company. So that was my life for about 6 years. So I said to the new contracting company, while I'm just laying here, rehabbing, why don't I go get my physical so that I can start my job? And he
Yes.
said, we're not saving a job for you. You don't have a job. So,
And after you pick yourself up off the floor after hearing something like that, because as far as I understand, how can someone fire someone because of that for such a reason?
something told me, don't fight this, just go ahead and make something happen.
Interesting.
So I literally got down on my knees and I
Yes.
said, Lord, what do you want me to do? So this whole time I had wanted to start my own home therapy business. So as a PTA, all I needed was a PT and referrals and patients, and I had everything ready to go. I had all of my disgruntled coworkers. We were all ready to go. I had my computer programming, my license, everything ready to go to start my own business.
Is God not amazing how He
Yes.
can prepare you for that
Absolutely.
and turn everything
Yes.
around for good?
Yes.
This is
the book
much better.
I'm reading right now is Max Lucado, God Makes a Mess. How does God make a mess through it all? So I was down on my knees praying, had all this stuff ready to go for my own home therapy business. And my husband's dear friend called and said, Stacy, I've been in the insurance business for almost 40 years, and we're branching out and starting a Medicare division. Can we just meet for lunch? So I said, sure, why not?
Yes.
So we met for lunch, and I went back to school. So 50 years old, I go back to college.
Yay.
And yes, and I had to get licensed in life, health, and annuities.
How hard was
And
that?
It was very hard because I
Yes.
hadn't taken a test in how long?
Right.
When you graduate college, you're in your 20s.
Yes.
And here I was, 50, trying to learn, a 3/4 of an inch book thick of insurance, life, health, and annuities. And I did not pass the test the first time, actually.
Well, they're hard tests.
They are, and some young kid told me, he goes, Stacy, you realize that the testing center is a business, don't you?
Sure.
And I said, oh, yeah.
They make money every time.
They make money, too.
If you have to retake it, they're happy.
Right.
Interesting.
Yeah.
So you passed, and now you've set yourself up as someone that people can come to and get advice.
Yeah. So I'm working with Boast Benefits. We have several agents all over, the country. The headquarters is in Newcastle, PA. But our office is right here in North Canton, right on South Main Street, on the corner of South Main and Glenwood.
Okay. Give us an address exactly.
It
where
is
we find you.
925 South Main Street, Suite B in North Canton.
Great.
44720.
And your phone number?
My office number is 877. It's toll free. 877-283-7600. And you have to push my extension is 166.
Okay. And that's how we can get a hold of you to walk us through this.
Yes.
Okay. Tell me about that first appointment with you. I'm coming into the door and sitting down, and I know nothing. Where do we start?
Well, first of all, that's a great question. I cannot call you. You have to call me. That's Medicare guidelines. And I'm going to ask you, do you have A and B? So that's the first question. So you need your little red, white, and blue card with A and B. And then I have a health benefits analysis sheet that I can email you, and it's all laid out: name, address, phone number, all your doctors, all your medicine, all your dosages of all your medicine. Okay? So with that, I like to get all that information even before our appointment so that I can do my homework and know what's going to be the best plan for you, and I have to know what county you're in, because it's based on your county. If you go with a med supplement plan, which you're guaranteed issue when you turn 65, there's no medical underwriting questions, then you don't have to worry about what county you're in because your plan is good for anywhere.
Okay. Now, because I thought there were some plans that I would only be able to get served here in Ohio. If we were to happen to be down in Florida, let's say, and something would happen, something wouldn't work down there. Am I...
Not necessarily.
Okay.
So different carriers have different plans that you can take throughout.
Got it.
Okay. Some are local, but some are national.
And you will sit down and you'll show all of these.
All of those.
Well, okay, here's another question. In free enterprise, why is there such a huge difference between what some cost and what others cost? Do you get anything different?
Well, in the Med Advantage plans, you will get vision, dental, most of them. You'll get vision, dental, hearing, over-the-counter benefits.
Okay.
Silver sneakers, for instance.
So that's
and then,
Medicare Advantage. And is that what you really recommend people do?
There is a statistic out there that and don't quote me on this, but...
We won't tell anyone.
Okay, yeah, don't tell anyone.
Okay.
In my clientele, about 80% of them have a Med Advantage plan, and about 20%, maybe less, have a Med Supplement plan with a drug plan.
So it sounds like right around the time of life that you stop paying your mortgage, this enters in and says, oh, not so fast. Don't celebrate quite so fast because this kind of takes over. Is that a fair assessment?
Yeah, that's a pretty fair assessment, yeah.
Okay, so this takes the place of that.
Yeah.
Okay, so can we really ever stop working? I mean, seriously.
Got to always do something on the side.
Have some kind of side gig going on. That's right.
For instance, when you said how confusing it is, like in Stark County, let's just go with Stark County. This is Stark County. There's 66 Med Advantage plans in Stark County. So how do you know out of 66 plans which ones are the best?
How do you?
So we do have a special formula to figure that out.
Walk me through that. How do we? What can you tell us here?
Well, I recommend about 4 or 5 different plans. So, I try not to use the words like always, only, never, best.
Right.
So based on your doctors and your medicine and things like that, and what's important to you. Like, I'll give you an example. 2 sisters I had, okay? One had a Med Advantage plan, and even her dentist was in the network. With Med Advantage plans, you have your HMO or your PPO, your health maintenance organization or your preferred provider organization.
Okay.
And those are like networks where you have to stay in the network with the doctor. Or you have a med supplement plan where you can choose any doctor, any hospital in all of the United States and emergency rooms worldwide. No matter where you're at, you can always have emergency room care. So these 2 sisters, one was on an Advantage plan paying $0, and she had dental, vision, hearing, over-the-counter benefits, and silver sneakers.
For nothing.
For $0, okay? Her sister had a med supplement plan, and she didn't have vision, dental, hearing.
Right.
She was paying $40 a month to go to the Y for her silver sneakers, and she had no over-the-counter benefits, and they both had the same dentist. The sister that was on the 0 premium plan went and got her teeth cleaned. Well, that's part of her plan. $0 for her dentist to get her teeth cleaned.
Right.
The other sister paid $155 to get her teeth cleaned.
Yes, that's what it costs.
That was paying the $180 for the premium. And she said during annual election period,
Yes.
Stacy, put me on the plan that my
No kidding.
my sister's on.
Whatever that is, that's what I want.
Right.
All right. This is open enrollment right now. Yes, we're seeing things. We're seeing Joe Namath. He's
Yes.
telling us, get this
Right. Open
going.
enrollment is January 1st through March 31st. And open enrollment is for people on a Med Advantage plan that can switch from one Med Advantage plan to the next Med Advantage plan. Okay.
Okay.
Unlike the AEP, which is the annual election period, that's October 15th through December 7th. That's when you can switch plans from one plan to another.
Okay. Good to know.
Yep.
And I understand that you may be coming on board as our WNPQ The Light family, and people will be able to hear you and find out a lot more.
I hope so.
Stacy King, thank you so much for joining us in our community today.
Thank you.